Women who are suspected to have breast cancer are facing life-threatening delays in diagnoses and treatment due to backlogs in Queensland. Joining us live now is BCNA Director of Policy, Advocacy and Support Services, Vicki Durston. Vicki, what are your concerns here? Why the delays? I mean, the clock is ticking, isn't it, when it comes to tackling breast cancer and starting treatment?
Yeah, thanks, Ash. What we're hearing is that in Queensland there are significant delays in those test biopsies results to actually confirm a cancer. And when someone's waiting, I mean, the fear of waiting and the anxiety that that creates for someone, let alone making sure that we can have treatment start right away, particularly for different types of breast cancer where they can be more aggressive. The sooner we can treat and start treatment, the better outcomes that there are for people with a cancer diagnosis.
So I assume you've been asking questions about the cause of the delays. What do we know about why that's happening?
Yeah, I think it's a bit of a pity when you start to hear whistleblowers, and certainly we've heard through phone calls through our helpline at Breast Cancer Network Australia where people are exasperated and not able to get the answers they're looking for. We would welcome that conversation with the government. I think what we're wanting to see is what those short-term and long-term solutions are to ensure that people are diagnosed within a timely manner. And I think what we know is through the Australian Cancer Clinical Guidelines is that we need diagnosis to occur within weeks and not months. And we need to understand what those strategies are to address this issue.
Because, Vicki, what are the odds of beating breast cancer if it is caught early, and how do those odds sort of shift if it is discovered much further down the track?
Yeah, well, we certainly know that cancer won't wait. So the message that we've always been strongly advocating for is early detection saves lives, and early detection ensures that we can manage risk, so we can manage those cancers that are more aggressive than others. But it's really important that the sooner we can detect and diagnose, the improved outcomes that we can see for people with a cancer diagnosis.
More broadly around the country, do you know if we are seeing similar sorts of backlogs and people having trouble getting appointments? A lot of women, I assume, would have missed their regular mammograms due to the pandemic. Has that been a problem as far as you're aware?
We know that there are strong screening programs around the country. So our breast screening continues to be well managed. This is often when someone has a suspected cancer and needs to be biopsy and tested. And we know that our health system and services are under extreme pressure with workforce. And this isn't unique to Queensland. So we are seeing this in some states around the country. So when we think about workforce strategies, we need to think about the impact that that's having on other states as well. When we start to hear incentive programs for offering clinicians within other states to come and work within Queensland. So we really want to understand what those strategies are and how they're being used effectively.
And Vicki, how many women are we talking about here in terms of who gets breast cancer? I think the stat that comes to mind is 1 in 8 women. Is that still about right?
So it's 1 in 7 people will be affected by breast cancer. And so we know that the screening programs are the best way to pick up and detect earlier breast cancer, but also if people are noticing any changes or symptoms, that they actually seek out the attention of their GP and get that looked at immediately.
Gosh, 1 in 7. Okay. Vicki Durston, really appreciate that. Thank you. Also a good reminder for everyone to keep up with those screenings. Thanks so much for your time.
Thanks, Ash.